moving forward, our next speaker is going to present on the healthcare outlook. Rand Wortman is the CEO at Kadlec Regional Medical Center. Rand has been the CEO since November of 2000. He previously served in various executive roles in his, can I say it, 39-year career, including CEO positions at hospitals in Florida, Illinois, Texas, and Pennsylvania. So let's welcome up Rand. And Rand, maybe you could make a comment about the potential new medical school proposed by various universities in Spokane, whether that will happen or not happen, and is it true that the driving factor for success for whomever opens a new medical school is going to be the residencies available throughout the communities in the rural counties of Washington?
Well, first, thank you for inviting us, and thank you for allowing us to sponsor again, Carl, wherever Carl went. The university medical school question, I didn't quite prep for that today, but basically what happened is the University of Washington has restricted the number of physicians that they train to a much lower number than what's needed in the Northwest. So many students have gone out of state, and frequently they don't come back. WSU has decided they would like to start a medical school and fill that void. And there's clearly demand. You can see all kinds of charts that show that we're 49th or 50th in the country as far as the ratio of physicians produced to the population. Basically, WSU said, we want to do this. UW said, oh, we can step up and do more, after years of not stepping up and doing more. And it's going to be a big political battle in the legislature over dollars. UW is saying, you know, for a few more dollars we can expand, and WSU is saying, no, it's time somebody else did this too. WSU has a major presence in Spokane. I think they own a building up there. They have a medical school campus, if you will, and students from the UW program go to Spokane for the last year or two of their program. I suggested to Carl and some other community leaders that the Tri-Cites ought to make a pitch to become a location for medical school, and that there ought to be a medical school presence here. Personally, I think the odds of that are probably close to zero. There's not enough money to go here, Spokane, Washington, Seattle, all three. But I felt like we needed to get our name in a hat, so if there was some piece that they could do here, they would know about it. And the community leaders and with Tri-Dec leading stepped up and said to UW and WSU both, they said, we want to be Switzerland. We don't want to get in the middle of this battle between you two. But whoever expands medical schools in this end of the state, Tri-Cites wants to be a player, and we want to have as much of that medical school presence here as we can. So I think you'll see some pieces of the medical school, some of the rotations through the Tri-Cites, but the medical school won't be here. I think that's what Fran was asking. So that's my take on it. You know, I've done this in the past, I don't know, several times over the years. And the message was pretty negative for 2 or 3 of those talks because of where, well, you know, 5 years ago I stood up here and I said, nobody's talking about health care, but it's really broken and we're going to have to talk about it as a country and it's going to rise to the top. Well, now 2/3 of the news is about health care. So those things did come to pass. But what I wanted to do today was talk about I just kind of did a David Letterman thing, so let me figure out the top 10 trends on a macro basis that are going on around the country and talk a little bit about what that means here. You still have the Affordable Care Act, commonly known as Obamacare. And I won't spend much time on that, but that's clearly having a huge impact on our industry. The second major trend is we're moving from an inpatient business to an outpatient business. We saw this recently. A couple years ago, we bought one of the Da Vinci robots where the surgeon sits over here at a table and does surgery on a computer, and patients over here and the robot's doing the surgery. And I was looking at some of our statistics recently, and our GYN inpatient surgery just went like this. It just fell off to nothing. And I said, who's angry at us? What did we do? And we went and pulled the data, and so many of those ladies are getting outpatient surgery with a Da Vinci robot, and the complications are less, and the recovery time is less, and now they're doing them as outpatients. So we're going to see more of those kinds of things. Clinically integrated networks. What that means is instead of having a bunch of independent physicians and a nursing home over here and a pharmacy over here and all the different pieces that y'all have to deal with as you try to navigate the healthcare system, it means that they come under one company or under one roof, and it is all coordinated, and care gets better. So we're being forced for financial reasons and quality reasons both to become more clinically integrated. And part of that is, Kadlec just joined Providence last June. There's another thing that in our industry we're calling population health management. And what that means, we currently get paid, if Fran comes in with a bad gallbladder, we get paid for taking it out. If he comes in with a heart condition, we get paid for making him better. If he comes back in 6 weeks for another heart condition, we get paid for taking him better. Down the road, it's going to feel kind of like the old HMO. Somebody, I don't know who Fran has insurance with, but his insurance company's going to come to us and say, we've got 10,000 Fran Forgets in this community, and we'll give you, and I'll make the numbers up, we'll give you $100 a month for each one of them, and you bear whatever the cost is. Now, they call it, population health management, but it's basically making us into an insurance company. And all of a sudden, instead of trying to make Fran better when he comes in, I need to figure out how to get him exercising more. I need to figure out how to get him to lose weight and make sure he takes his medication. Make sure, I don't know what conditions Fran has. I'm making all this up, so I'm not picking on Fran. But, yeah, so the world's going to get turned upside down. And the 1%, 20% you see on the screen, I read recently that 1% of the population burns up 20% of the healthcare expense. And if we can control that 1%, if Fran's not compliant, I'm going to be doing my darndest to figure out how to get him to be compliant for healthcare. And then value-based purchasing is simply the payers, including the governments, are beginning to say to us, if you don't achieve this level of quality, we're going to pay you less. They're not saying if you do a great job, we'll pay you more. They're saying we're not going to pay you any more, but we are going to pay you less if you don't step up. The next one that you're going to see is consolidation of providers. If you look around the country, hospitals, doctors, everybody's joining a bigger system. Kadlec joined Providence. We had in 2006 we had no employed physicians. Today we have 150 physicians and physician assistants and nurse practitioners, and we'll be 200 by the end of this year. There's no doubt in my mind. And the number of hospitals, there are hospitals closing around the country, but the big trend is their hospitals are joining up with bigger systems. And I'll talk a little bit more about that in a minute. Transparency. In a few years, it's going to be really easy to find out which hospitals are the good hospitals, which doctors are the good doctors, which ones get the best outcomes. People are getting more and more transparent about that, and the payers are beginning to use that. Individual patients are undoubtedly going to begin to use that. So it's going to be a lot easier to figure out who you're dealing with. Electronic health record. There's a big move nationally, and the federal government subsidized it, to standardize electronic health records and make it very portable so that, if I'll pick on Fran some more, Fran comes to Kadlec and has his heart condition, and he's traveling to Miami. The doc in Miami or the ER in Miami is going to be able to go in and pull up the information on Fran that happened at Kadlec and happened in the doctor's office and his lab results from Tri-City laboratories and on and on and on. It's a real challenge for us, but it's really beginning to happen on a big scale. Patient apps, you're going to be able to do a huge percentage of your health care on some sort of tablet, iPhone, whatever it is you use. Providence has a whole division that's developing those, And it's just mind-boggling, the kinds of things they're thinking about, stuff that never crossed my mind. There's a lot out there already nationally, but you're going to see that come down to the local level. And then the last thing is we struggle with patient privacy and convenience. We have the federal government telling us we have to get this information and make it available everywhere, so no matter where Fran's at, somebody can access his health information. But at the same time, we've got HIPAA guidelines that tell us we're not allowed to tell anybody that Fran's even thinking about being sick. So how do you make it available to everybody and at the same time totally protect it so nobody can get to it unless Fran says it's okay? And that conflict is really large in our industry right now. So now I'm going to go through each one of these just quickly. Obamacare has led to a lot more people that have Medicaid. They're insured. But what the plan was to get all these people who had no health insurance and get them on health insurance. Well, they put them on Medicaid rates, not Medicare or higher. Medicaid pays very poorly, whether it's hospitals or doctors. They don't pay any of them very well. And an interesting phenomenon in the Tri-Cites, Kadlec has seen, whether you look at inpatient or outpatient, the number of Medicaid patients we have has just skyrocketed since Obamacare came in. But the number of patients who have charity or self-pay has only gone down a little bit. So clearly what's happening is that there are a huge number of people who had no health insurance and were not getting services anyplace. And now all of a sudden they're getting services. And that's exactly what the plan was. The problem is the insurance they have pays so little that you can't even make it on the margin. So it's really stressing the system. It's stressing the system because they're filling up doctors' offices and appointments, and the money's not there. So as I've said for the last couple of times I was up here, we have to do more with less. So that's one of our challenges. I believe there's an initial bolus of people. There's all these folks that had no health insurance that are now swamping the system. They're just coming out of the woodwork. My hope is that eventually those people will stabilize. They have lots of medical conditions that will stabilize and it'll come down. But we haven't seen that yet. That remains to be seen. Is Jim running the slides? Give me the next one. The inpatient to outpatient, we're actually seeing more ICU patients. The people that get into the hospital are sicker, but we're having fewer total inpatients. We're seeing around the country, they're doing total hips on an outpatient basis now. That's unheard of. The gallbladders have been an outpatient procedure for 20 years now. The patients that are in the hospitals are going to be a lot sicker. Our new construction project includes another ICU. Jim? Clinically integrated networks. There are almost no independent physicians in some communities. The rural communities have been, the rural hospitals have employed all the doctors in our community for years because nobody could come in and successfully start an independent practice. But in a very few years, the Tri-Cites is going to have federally qualified health centers, and that's Tri-Cites Community Health and Yakima Valley Farm Workers. They have a clinic in Pasco. They call it something different. I've drawn a blank on the name. But the hospitals and the federally qualified health centers are going to employ almost everybody. You won't see hardly any independent physicians. You'll see horizontal and vertical integration. For us, that means we're going to have relationships, and I don't know whether that means ownership or contractual, but we're going to have to control the care and be involved in the care from the home to the doctor's office to the hospital, the laboratory, rehab when you get out of the hospital, and back to the doctor's office and back to the home. You're going to see healthcare become integrated all across that spectrum. Right now it's very piecemeal. You're going to see more nurse practitioners and physician assistants because of the shortage of doctors. We're starting to see better communication among physicians. I think one of the biggest challenges in healthcare is getting the providers to talk to each other about the patient. Fran has 8 doctors and they don't talk to each other. Something gets messed up. As we get them into one unit in one company with one electronic health record, they're all looking at the same information. They're all looking at the same problem sheet. They're all seeing the same medications. Care will improve. We will get better outcomes, and your care will be safer as a result of that. Population health management. As I was saying, we're going to have to learn how to influence the community's behavior. We're going to get into non-traditional healthcare stuff. There's a hospital, I forget where it was at, that had a bunch of readmissions on congestive heart failure, and What they found out was these patients that kept coming and getting readmitted to the hospital, they were in a hot climate, it was humid, they were poor individuals, they couldn't afford electricity, they didn't have air conditioning, and the hospital was being penalized because these patients were being readmitted, so they went out and bought air conditioners and put them in these people's houses, these window units. And the cost of the air conditioning unit was cheaper than the penalty they paid for the patient coming back in. You're going to see hospitals and healthcare systems start looking at what you're doing and how you're living and trying to influence your health in some very non-traditional ways. Eventually, we're going to have a healthier community and a healthier country, but you guys aren't very cooperative. You're not very compliant, and it's going to be an interesting challenge. And we're also starting to see non-traditional providers, CVS, Walmart, and others are getting into healthcare. Value-based purchasing, we're going to get paid better for better outcomes. I think you're going to see a concentration of care. The providers that are currently low quality are going to, the information will get out, everybody will know they're lower quality, they'll get paid less. The places that have high quality are going to be more successful, and you're going to see a bigger gap between the haves and the have-nots in healthcare, just like you do in a lot of other things. The consolidation of the providers, I already talked about that. There's a lot of discussion about, and I'm not talking about the Tri-Cities here, I'm just talking in general. There's a lot of talk about hospitals and what's the right size for a hospital and what's the role of a rural hospital. Rural hospitals are really trying to figure out who the heck they are. They want to align with the bigger systems and be part of the integrated systems. Transparency, the power of knowledge. The public's going to demand cost and quality data. There's a lot out there now. It's not very good, but it's getting better every year. It's going to be available on the web. You're going to see pricing information. A few years from now, you're going to be able to go to a site and it says, here's 8 hospitals in this region that provide this service, whether it's a gallbladder surgery or, and they're going to be able to tell you, this hospital's agreed to do it for this price. All in, total price, that's what you're going to pay. You're going to see that come down the road. And you're going to see us eliminate the insurance companies. Providence has just done a deal recently with Boeing over in Seattle, where Boeing pays them X amount of dollars, and Providence takes care of all their employees, and there's no insurance company in the middle. Now, there's probably a third-party administrator that's doing some of it, but you've got direct contract between a company and a provider with no insurance company in the middle. You're going to see more and more of that. Electronic health records. There are some government-mandated standards, but basically we're trying to get to the point where, as an industry, where certain elements of the record are standardized. The history and physical, the medication administration record, the doctor's notes, I don't know whether there's 10 items or 50 items, but they're trying to standardize that, put them all in a common format, and tell every electronic health record vendor, you have to use this format. And then when Fran's in Miami, no matter what system they're on, that information is available. They can dial into it. In the Northwest, that's almost academic now. There's a software system called Epic. It's out of Wisconsin. And they have something like 50 or 55% of the patients in the United States go to a provider that's on this Epic software system. What they did is they went to all the big teaching centers. And Kadlec's one of the smallest systems on Epic. But those systems are already designed to talk to each other, and most of the major providers in the Northwest have that. All the Sacred Heart facilities have it, all the Providence facilities include Sacred Heart and Swedish and us and others. The digital apps, I'm not going to go into detail on that, but everything you do will be available on an app. It's just incredible where that world's going. This is the patient privacy versus convenience. I already talked a little bit about it. We have to share the information. The rules are so tight. I think you're going to see a huge number of data breaches in healthcare. I just don't see any way around it. We have so many disparate electronic health systems, health records that everybody's using. And the IT requirements are so high, and the security requirements are so high, and there are so few really great IT people. It's hard to get good IT people. It scares me when I look at the way hospitals protect patient information. We spend an incredible amount of money. We have outside people try to hack into our system just to find out what's weak, on and on and on. And I'm absolutely scared to death there are going to be a lot of data breaches, I believe. I just don't see any way around it. As a society, we've got to somehow balance that immediate availability of everything with protection of everything. So in summary, I think the quality of care is going to go up. The cost will eventually go down. We can't continue to pay what we're paying now and spend as many resources. You're going to see a lot more nurse practitioners instead of primary care doctors. Overall access is going to go up, and that's happened in the Tri-Cites. All 3 hospitals have hired a ton of primary care doctors in the last few years. To the best of my knowledge, access is not a problem, at least at the primary care level. Digital access will go up. Transparency will become much more common. You're going to see a decrease nationally in the number of systems and hospitals. And eventually you're going to see an improvement in community health. That's what has to happen, or we're going to go bankrupt trying to pay for health care. So that's what I see happening nationally, and I tried to avoid any discussion of particular providers locally, or, Kadlec, Kennewick, Pasco, and so forth. But the trends are clearly there nationally. So I don't know, Carl, do you want to, you're right at 11, you want me to do any questions? Any questions? This is dangerous, Carl. I can probably get them. Thank you.
Our next presentation is a new addition to the Outlook Forum. For the last 3 years, Tri-Cites has partnered with Gallatin Public Affairs in sharing their Washington State business survey with members and the Tri-Cities community. Here today we have Eric Williams, a partner with Gallatin Public Affairs, to present their findings. And I think you're going to find it rather interesting, both as to the local level findings, statewide level, maybe some Seattle findings, and so on. So, without further ado, please welcome Eric Williams.
Thanks, Fran. First, I'd really like to thank you all for the opportunity to be here today, and particularly want to thank Tri-Cites and all of you folks who have participated with us in our business surveys for the past 3 years. At Gallatin, we operate at the nexus of politics, government, the media, business, policy, and a lot of what we do is help companies through difficult challenges, navigating all of those sorts of things. So while we've had a lot of emphasis on data today, that's been really interesting for me to see all that. Particularly things like how the hospital uses data to chart after the robot. I thought that was absolutely fascinating. What we do is use data for a little different purpose. We use data to measure public sentiment. So you say, well, isn't that kind of fuzzy and isn't that kind of mushy? Actually, we use very scientific methods to come up with very rigid data. Now, how can that possibly work, or how can that be useful? I happen to be a big fan of RG3, the quarterback for the Washington football team. I was a really big fan when he was at Baylor. He's very dynamic, just a really joy to watch. He had a particular statistic that caught our attention, however, that told us a lot. In 2013 season, which was the year before, he was 3 for 26. Anybody have any idea what that was? Had nothing to do with passing, nothing to do with running, but sort of had everything to do with team dynamics. He was sacked 26 times. For you non-football folks, he got tackled behind the line of scrimmage 26 times. And 3 times, a teammate came and helped pick him up. Now, that doesn't tell you anything about how good he is athletically, but to us, that's the sort of thing that we like to look at, is what does data tell us about team dynamics or dynamics between business and the public. So the survey that we did in December and then teamed with Tri-Cites on, first we started out with 400 statewide likely voters. So when you do 400 statewide likely voters, now this is a telephone survey, both cell phones and landlines. When you do 400 statewide, you get about 290, 295 in the heart of the Puget Sound. So we also wanted to be able to measure sort of east versus west dynamics. And so we had to do it what we call an oversample of 200 folks basically east of the Cascades. So it's where we're from in Spokane and you folks here. Then on top of that, working with Tri-Cites, with the Greater Spokane Inc., which is your peer in Spokane, and then the Downtown Seattle Association, we did self-select. That means, hey, I'm a business person, I'm a member of Tri-Cites. I'm going to go in and answer 20 of the questions that we asked statewide. And this enables us to do all sorts of comparisons. Obviously, the first question we ask is, how do you feel about the economy? Again, we're trying to measure public perceptions. As you can see, 3 years ago, things were pretty grim. We were a pretty glum bunch statewide. But over time, things have improved a lot. So now it's basically a jump ball. Are people optimistic or pessimistic? Oh, by the way, at any time, if you see something on one of these slides or I say something, raise your hand, ask a question, feel free to jump in. So then we also slice and dice these things several different ways. You can tell Eastern Washington was not quite as optimistic. The Seattle business community, now there's a trend I want you to follow as I walk through this. The downtown Seattle folks are wildly optimistic. And then Eastern Washington business people are a little more optimistic than the rest of the folks in Eastern Washington. So one of the things that we do is ask, for example, in this survey was about 45 or 50 questions. And what we want to be able to do is compare and contrast how do different subgroups of people think on different issues. For example, one of the questions we ask on not only this survey, but almost every survey we do is, do you think, which is more important to you, jobs or the environment? Now, people can have the debate if you can have both, but we very much want to have people tell us which is the most important for them. So then later we can take who are the strong, what we would call 10 on enviro, very, very much heavy on environmental, or 10 on business, and slice and dice those to help us determine how are we going to talk to these different groups of people. So as you can see, too, at the very bottom, if you can see it, people who are really tied to or look at technology as the driver for our for our economy in the future are very optimistic. Folks who say have a leaning towards agriculture are substantially less optimistic. That was a little disconcerting to Jared, my colleague, and I. Many of you folks know Jared Webley. Because I'm a Montana ranch kid, Jared's a Palouse farm kid, and we tend to be the glasses half full types. But you can also see in this question we asked, for 3 years running, we've asked, what's the most important business in the state? I'll go ahead and take a minute and look at that. Boeing, that's not surprising that over the 3-year span, Boeing has receded. It is a little surprising to us about farmers and agriculture receding that much. And who's taken up that space has been Amazon and Costco. And Amazon, when you dig 2 or 3 layers further into the numbers, it's all about those people who are really optimistic, who are tech-driven, and they tend to also vote for example, Amazon. Now, one of the other things that you learn in doing polling is you don't always like the numbers you get. So again, as a farm kid, I'm a little unhappy that farmers and agriculture are dropping, but the numbers don't lie. That's what's happening. But again, to be a little more optimistic, not so much in this poll, but over time in some other polls, we've asked a lot of questions about how do folks in the agriculture business talk to or communicate with people who aren't farmers and ranchers. And particularly, we've looked at how do they communicate, say, with, in Washington State, West Side tech folks about environmental issues. And we've tested all sorts of different messages. And if a farmer stands up and says, we're really good stewards of the land, we really like to take care of things, the folks on the West Side go, oh, thanks, everybody says that, right? You're not really reaching them. But if farmers start talking about, here's how we're using GPS or other technologies to reduce our footprint, we're reducing our pesticide use, our herbicide use, we're reducing erosion, then you get the attention of the West Side tech-driven folks. So that's one of the ways that we can use surveys, use polling to help business learn how to better communicate with whoever they need to have conversations with. I didn't realize that there was going to be some discussion earlier on the WSU Med School, but in this survey and lots of the surveys we do, we take a look at what are topics of the day, what are issues that are of importance within the region, within the state. So one of the questions we asked is, hey, are you for or against WSU opening up a second state-affiliated med school in Washington? And while we expected it to be generally favorable, we were frankly pretty astounded at the level of support that there was. And also, it was very widespread. Naturally, the Seattle, that SBiz, that's the Seattle business folks, downtown Seattle folks, that was easily the least supportive bunch on this, which is more than understandable. University of Washington Medical School is a first-class, wonderful institution, and it has a lot of ties in that Seattle business community. So that really wasn't a surprise. I didn't bring the data just to keep it short, but we also asked a follow-on question, the sort of the if you knew, and that if you knew was, hey, it's going to cost the taxpayers some money for WSU to have a med school. The numbers dropped basically equally statewide by 3 or 4 points. So it was still really, really strong support. One of the other things that's important, someone touched on it a little bit too, that we did not delve into in this particular survey, but one of the things that WSU, as I understand, is contemplating is having, the first 2 years, I think, of med school, students will go to the facility that was mentioned in Spokane, and then the second 2 years, they'll basically, I think, a quarter of them will go to the North Puget Sound, a quarter of them come here. And again, data-driven, there's strong data that demonstrates where students go to school, they have a much stronger tendency of wanting to practice in those areas. So again, yeah, sure. Yeah, great question. The 400 statewide is how it comes out. So there's, again, out of that 400 statewide, you're going to have about roughly 290, 295 in the Puget Sound, and the other 110 spread throughout the rest of the state. And then it's when we fold in, like the Eastern Washington you can see there, that's where we fold in the additional 200. So to get really into the weeds, that Eastern Washington is going to be about 300, because we don't just include the oversample, we include the 100 who were in the initial. That make sense? Again, anybody else, stop me at any time with questions. So another one of the questions that we asked, now this is more of a West Side question, but we asked it all across the state, was, are most of you familiar with the Bertha and the, I don't want to say ill-fated tunnel, but the tunnel that hasn't gone extremely well? Are people for or against just saying, heck with it, let's stop? So not a lot of surprise. I was actually a little bit surprised at the low. I thought support might be higher for progressing on with the tunnel. And not at all surprising again here, although you're going to see various times the Seattle business people on a lot of issues are way different than the rest of us in the state. But again, on this, it's not surprising that they were for that. from a data junkie standpoint, if you recall, we took this survey December 1 through 5, and I can't remember whether, I think it was the 8th of December, around in there. There was 3 or 4 days straight of really, really bad news about this tunnel. Lots of slumping, not just at the tunnel, but with neighbors. So you never want to guess on surveys, but had we taken a follow-on survey 10, 15 days later, we're relatively certain those numbers would have been lower. Now, that's easy for us to say and easy for the public to say. It's probably pretty hard to just go stop that project. Another one of the issues of the day that we looked at, certainly a lot of legislators have been interested in this. As I'm sure most of you are aware, Governor Inslee has proposed various things for A, raising revenue, and B, reducing carbon emissions. We asked, in this particular survey, in this public survey, we only asked the straight-up question, hey, are you for it or against it, the cap and trade? What we don't have here is data on sort of the if you knew. So everybody likes, yeah, we're going to tax the big evil polluters, make them pay, get a lot of revenue. Well, it's like most issues, it's much more complicated than that, and some of us might feel a bit of the cost of that. And we did not ask that particular, or the follow-ons on this. Now, I'm going to spend a little bit of time walking through this transportation gas tax divide. And what we mean by that is there's various proposals that have been put forth, not just this year. We happen to pick these 3. There's any number that you could pick. But one of the things that you'll find as we go through these slides is a real divide between the 2 sides of the state in how and whether to address fixing our roads, et cetera, through a gas tax. So there's 3 options. One, the blue, stay the same. And this here is the statewide numbers. 4-cent increase, which essentially amps up maintenance, a lot of bridge work, that sort of thing. And then 11-cent proposal was amping up all of those things, in the increased maintenance, increased bridge work, plus some a lot more public transit, that sort of thing, a lot of west side projects. So I don't know if that's a surprise to anybody, but if I'm a state legislator, I'm going, not a tremendous amount of support for reaching into the wallet to pay for transportation. And again, I really want to emphasize, I'm not advocating one way or the other. This is what the public tells us. So you've got the statewide, then you have Eastern Washington, and then you have the downtown Seattle business folks. Now I'm just going to move on to the comparison. Look at this horseshoe. Boy, do we see the world differently in a couple of places. Now, again, if you take a half a second and think through, where's the real problem? Where's the real congestion? Where is it a big pain in the fanny that we've got some we've got some road issues out here in our part of the world, but the real clogs are in Seattle, and it's real clear that the Seattle business community would love to have a gas tax to pay for a whole bunch of remedies for that. So I had a conversation with our office managing partner in Seattle, Bruce Gruniski, about, okay, I'm over here in Spokane and live in Eastern Washington. You're in Seattle. What does that mean? And to him, it meant several things, but he said mostly Seattle is going to have or figure out a way to have a conversation with the rest of the state about how does it remedy its transportation issues. So this is the sort of thing that polling, that data collection helps us, again, how do you navigate all of these problems? Our pollster, let me take a quick sidebar here. Our pollster is a company called GS Strategy Group that we have a sister firm with a joint venture firm. They do some fair amount of political polling. For example, from out west here, they're John McCain's pollster. In the east, they're Chris Christie's pollster. They do a lot of work for the likes of General Electric, not nationwide, but the major National Insurance Association, that sort of thing. And again, all of this data helps us help you, whatever your situation is, navigate the political waters. So then you layer that into a question that we've asked all 3 years. And this one typically gets a bit of a chuckle. Does King County have too much influence in the politics of the state? Agree or disagree? How many people would agree? But it also presents an additional challenge for our state trying to navigate things like, okay, are we going to have more gas tax to fix our transportation problems? Because all of us out here, not all of us, but a pretty hefty majority of us here in flyover country think King County's got way too much influence. So that's a political or kind of a social dynamic that if we're going to wrestle with these sorts of problems that we're going to have to figure out. Now, the really fascinating part about this question is, hopefully you can't, if you can't see it, 56% of the people in King County think King County's got too much influence. How can you argue with that? And look at their friends in Pierce County. Any questions before I head off to one more topic before we're done? So we do a lot of work in the natural resource industries, not exclusively, but that's a big part of our business. And all throughout the West, we help companies navigate the permitting process, basically the social license aspect of, for example, most of my practice is in oil and gas, mining, that sort of thing. Nobody's real thrilled to have a big copper mine right outside their front door, but everybody wants the copper to make sure that they have the electricity in their house. So again, we want to help companies or proponents figure out ways to navigate. How does the public feel about it? Because the days of being able to just come in and say, hi, we're going to bring a bunch of jobs, everybody get out of our way, those days are long gone. So how do we develop the social license? See the data up there for a minute, and then I got another question that I would like a show of hands on, our own little focus group here. How many of you are surprised at this, that this is statewide? So you got, again, 290 folks out of the Puget Sound. How many folks are surprised that voters in the state support coal and oil trains? So we've done similar questions for this and other polls, and when we do it, we tend to immediately get a reaction from environmental groups, and frankly, even stronger from the media that, well, that's just wrong. Everybody knows that everybody's against that. So let me take another little quick sidebar. We're often asked, hey, well, do you guys do push polling? I don't know if you know what that is, but it's basically using a polling instrument to try to convince the other person on the other end of the phone one way or another. No, and that's primarily because I can't think of a less economically feasible way of trying to persuade someone than to call and yell at them on the phone. And it's just a horrible way. It's an uneconomical way to try to use persuasion. What we do is ask a lot of questions that present both sides of the argument to find out what works with people. Now, Carl and I and Jared and some others might be able to sit around and spitball things. Well, hey, we think this message is going to work, or people are going to really resonate with this message. But as our pollster often reminds me, Eric, why guess when you can know? Let's go out and ask the public, and a lot of times you're really surprised at the answer. So we were wrestling with this about, okay, we have consistently over several years found that Washington, Oregon, and other states, there is quite a bit of support for things like coal and oil trains or similar fossil fuel transportation or use. But a lot of people don't agree, so we asked a follow-on question. Basically, we asked, so what do you think your neighbor thinks? And this was really fascinating to us. So 55% favor coal and oil trains, and they think that close to half the people at least are against them, and only a little over a quarter are for it. So, as Jared often says, the majority is convinced that they're in the minority. So we can go on and on about why is that, and I'm a former, or reformed, I should say, newspaper reporter, and to me I think a lot of it is the media. The media has changed a lot since I was in the business, but frankly I think it's a lot of media perception and media buying into a certain narrative. So that's it. I'm more than happy to answer any questions. You got any? Pardon? Fran says that we have plenty of time. So one of the things that we run into oftentimes is we had another slide and we cut it for time. I shouldn't have cut it out. In almost every survey that we do, we're really surprised by something. In this particular survey, we asked a question about Ebola, which at that time was a real hot issue. And I don't know if you all remember the bicycle riding nurse in Maine who came back to the U.S., who had served admirably over in Africa and at some risk, and she came back and was very defiant. You're not going to tell me whether or not I'm going to be quarantined. And then the media very much portrayed, didn't care whether they were Republican or Democrat, whether it was Chris Christie, the Republican governor from New Jersey, or Andrew Cuomo next door, the Democrat in New York, who was saying, this is a public health issue, we need to have people quarantined. And I thought that the media very much came down on the side of the valiant nurse. So we asked very straight up, which do you support? Basically the individual rights versus community health. And I was stunned. I was expecting it to be basically a jump ball. And Jared, I can't remember, was it what, 81% of Washington voters, this was the statewide number, and there wasn't a whole lot of disparity in the different subgroups. 81% said community health. So, Carl.
I have just one quick question.
Yeah.
I was very surprised on the answers to the cap and trade question, and we've talked about this before. But so have you shared those numbers with the governor or with the state legislature?
Yeah, we have, and not all of them have been all that. Well, some of them have been very pleased, and some of them have been not so pleased with those numbers. And again, I'll be real candid. We do some work for the fossil fuel folks. Some of them weren't real tickled with how that came out, but we're big believers in what is it? What does the public think? We're going to operate a whole lot better if we know what the truth is, rather than trying to finagle a way to manipulate that. I do want to have the caveat, though, that in this public poll, again, we did not ask, does this, this business here is going to have to pay more? You're Avista's second largest customer. Your rates are going to go up X percent. We didn't ask that follow-on question. Jared, do you remember? Did we have a question on minimum wage increase? I think. Gosh, I'm embarrassed to remember. There was about 50 questions. I'm going to punt here, and yeah, we did. And by and large, people are for a minimum wage increase. So you can go onto our website, gallatinpa.com. It's the same as our email addresses, and a much more detailed version of this entire poll, including all of the questions and all of the crosstab data, the slicing and dicing data, is there. one of the things that's very interesting, so again, our polling firm does work all over the country, and they are really finding that there's something of a shift nationally in some otherwise red states that are more and more inclined to be supportive of, and you saw it in this last election, what was there, 4 states or something, I think, that increased their minimum wage. So there's something of a shift in the red-blue on minimum wage. Now, $15 an hour, like at CTAC, your polling data is going to drop off. People are generally for something of an incremental increase in the minimum wage.
Did the respondents differentiate at all between use for education versus transportation, or was that all bundled together?
So in this poll, we didn't ask transportation versus education. We did ask some question if it was to go to education, and I think a reduction in like B&O. People are
I
even
thought
more
your slide said transportation and education, that it would be used for.
I'm sorry. Now I'm starting to catch your question. Yeah. Did we then? You're right. It's transportation. And do you like it if it's going to be for transportation and education? Then did we dissect those? No. Yeah. But I mean, with McClary, that's a very interesting question. And another one of the questions that I didn't put in here that was sort of fun was, okay, the state Supreme Court has declared that the legislators are in contempt. What should we do? And we even asked, one of the options was to jail the legislators, and there was surprisingly little support for that. But what was interesting was not a majority, but a pretty strong plurality said the legislature should do what the legislature wants to do, and the court shouldn't be butting in. Now, the Supreme Court probably doesn't care a lot about the results of our poll, but that was still interesting. Yeah. And so, no, but we did not dissect that far. Any more questions? So, Jared and I will be here through lunch, and if any of you have any additional questions, just grab us and talk to us. And thank you again so much for your hospitality, and thanks again for Tri-Cites being a partner with us in this poll.